as Liz alluded to, I got a number of different hats, and one of the ways in which I got introduced to Orca, and those of you who are observant will notice I'm not Liz, and Orca is very much the brainchild of Liz Ashall-Payne, who I'm sure many of you will know. And I got introduced to Orca through working with my colleague John there in a different guise. We were looking at intelligence and data and how you could use particularly healthcare system data and mobile data, and how did you get those two things together, and some of the things that we heard about just now, you know, are really live and big challenges to that. And that led me into discovering Orca, because one of the challenges that we found was, how do you get some sort of organisation? How do you understand where all these applications are? How do you connect people to these different applications? So what I'm going to do to start with is just let Liz's 10-year-old son give you the quick kind of overview of what Orca's all about.
Imagine if healthcare and technology really got connected. The population of UK is growing fast, and the population is growing older and suffering more long-term health challenges that need careful assessment, monitoring and care. This is putting more pressure on the healthcare system and making it more difficult to deliver high levels of care to everyone. So now the population has access to over 165,000 health and care apps. Some are great and some are terrible. Finding the best apps for your needs and knowing which are the best and safest is difficult, with lots of trial and error. That's where Orca comes in. We are the organisation for the review of care and health applications. Orca reviews health and care apps and makes it easy for you to find the best and safest health apps for your needs. The public can find the best apps for their needs, and professionals can use Orca to confidentially recommend apps to make sure they are getting the best treatment. And so now, all of the people can get the best apps and have more health success and get the people healthier. And healthcare and technology really got connected.
Okay, so you get a very quick flavour, and the beauty, I think, of Orca is its simplicity. In the end, what Liz and the team at Orca really kind of grasped straight away was, how do you solve these critical problems which are simple but rapidly evolving as more and more health and care apps come online. For patients and the public, how do they find the apps that are most useful to them? How do they know those apps are safe and can be trusted? How do health and care professionals find the apps that are useful to them? There's a whole series of apps that are actually designed to help health and care professionals. Same questions that they have. Also, how do the health and care professionals find apps to recommend for use? And we've just heard of a great example of that. How do health and care communities and organisations, whether they're commissioners, providers, charities, how do they embrace the huge opportunities in a safe and manageable way that health and care apps offer? And how do health and care app developers, conversely, differentiate themselves in a world of 100,000 or whatever the latest figure is of health and care apps that are out there? How do they really start to show that their apps are different, effective, safe, compliant with regulations? And really that was what Orca was all about. It's those four constituents it's trying to support. And at the heart of this is a really unique and robust review methodology, which takes into account, there's a slide after this that just shows the myriad array of emerging regulation around these sorts of things. Liz has alluded to the fact that will only increase as the European community are looking at those things again. But Orca doesn't just take those standards and regulations, it also takes user experience, and it takes a whole array of different things. And actually there's something in the region of 160-point question, review process rather, that each application, each app goes through. So it's extremely robust, and that will evolve and change over time as new regulations and new things come on board. And again, one of the real connections that drove us to Orca, and it drove me to Orca and John in the first instance, was all around data and interoperability, and I think that will become a big emerging feature of standards and regulation going forward. So the methodology is really the heart of this. It provides a level, first of all, and that level can go from 1 to 4. At the top end of that, that is something that should be a controlled device with a whole series of much more strict regulation. And at the bottom level, it's general well-being devices. And the actual review is structured depending on the level. So obviously, as the level increases, the review questions change and become more robust. It then goes through a value score. So using a whole array of, as I say, assessment criteria, it delivers a value score for the for relevant app, and it also gives a risk score, which is a counterbalance to that. So you end up with, at a high level, 2 very simple scores. You know, what's the value rating and what's the risk rating? And the hope is ultimately that that becomes the de facto standard that you can start to trust. But behind that, more information is available in different layers, as people initially start to try to kind of investigate, well, why is that value what it is, and why is that risk what it is? So that's the key part of it. That's just some indication of the legislation and regulations that have been incorporated into the review process. Now, I'm just going to let Liz herself take you on a little sneak peek preview of this, but only for about a minute or so.
Imagine if healthcare and technology really got connected. There are over 100,000 health and care apps available, and knowing which are the best and safest can be a challenge.
Just going to speed her along. She's not here, so I can get away with it.
When you visit our sites, you can read more about Orca by selecting Find Out More. Here you'll be able to read about who we are and what our goals and aims are. By choosing to use Orca's search features, you'll be able to find reviewed and featured apps and see which apps are best suited to your requirements based on their value and risk scores. If you want to access an app about a specific condition, you can select All Apps from the navigation bar. Here you can search for an app using a number of methods. You can search using keywords or find apps using the category filter. You can then sort your remaining results by rating, alphabetically, popularity, or by release date. There's also other useful information about the app that you can see when you click on it. Our visual rating indicates clearly the category, value and risk score associated with a chosen app. From this point, you can easily download the app.
Okay, so that was a sneak peek, but you can, if you register on the Orca website, which isn't .com, it's .co.uk, that was my deliberate error to just keep me awake, you'll be able to see that the full demo version of that playing there. So what I wanted to do then was say, well, actually, Orca's ambition's quite significant in a way. It wants to become the predominant standard by which people feel comfortable reviewing and recommending health and care apps. So in a way, one of its key challenges is it needs to get wide adoption. So the delivery mechanism for that is important. And what this visually tries to show you is that whilst there is www.orca.co.uk, there's also the predominant delivery mechanism is designed to be a number of microsites where Orca is embedded into either, for example, community-orientated digital strategies, health strategies such as CCG, websites, hospital websites, etc., or charities, having their own microsites with their own focus and orientation around specific apps that are relevant to their condition or cohort, all the way through to specialist providers. So the idea is that there are multiple ways in which you can embed the ORCA review process. You can narrow down the applications that you're particularly interested in initially, so that people can actively find those, or you can create this as a geographical component of your broader digital strategy. So that's kind of the delivery mechanism behind the ORCA approach. This is just an idea of some of the ways in which you'll be able to access and utilise the ORCA solution. So this is very much kind of things that are being worked on as we speak. But obviously for patients, users, public, the public at large, the search feature will be free to use, and they will be able to access that, and they'll get the basic review quite quickly, quite easily, with a very simple registration process. There is a pro license. So the pro license and the pro page concept, an interesting one. So for every healthcare professional, you can register, you can get a pro license, which is going to be extremely good value, I think. And what that allows you to do is it gives you much more information, much more detail behind each review. So for instance, we've spoken to a lot of diabetes specialist nurses. One of the areas that they're interested in is how do they become familiar with apps that are relevant to their area. So the Pro page gives them a real opportunity to search through and become familiar with apps that support the environment and the patients they're dealing with. It also allows them to actually recommend and review in a trusted and safe way. So they can actually push. They can sit in front of a patient and say, oh, this app will be very good for you, and they can send that almost like a referral or a kind of digital recommendation. So the Pro page, and also the Pro page has a load of reporting features that you can then track to see how much you are, how you're interacting with the world of health and care apps. The microsite then is simply your own digital version of ORCA, so it's embedding an ORCA platform into whatever you are currently doing. So for CCGs, that might be an inherent part of the emerging digital roadmaps and their strategies around that. For other organisations, as I say, charities, it's about embedding this as a feature that actually takes away from the simple, we think these apps might be quite good kind of recommendation approach. Microsite Plus is simply a kind of wrap around that. So what we found is actually quite a lot of people want training and specific training and development. So you go to a community of health and care professionals and say, here are the top 50 apps in your area, and actually actively take them through that, and you also take them through the features of how they might use that. That might also include things like helping people think about apps in the context of pathway or service redesign. And for developers, of course, the challenge here is how do you get the best review? How do you incorporate all the standards? How do you make yourself differentiated? And there's a number of different ways in which you can interact through that. This slide is just, I think, an illustration of what we think having a solution like ORCA really helps with. The world of healthcare apps represented on the left-hand side, huge amount, quite chaotic at the minute. Bringing those together in ORCA allows the coalition, no, that's not the right word, the bringing together of a number of key constituencies, obviously developers being one of those key constituencies and represented in the room today. The users, the healthcare professionals, and the communities and organisations that wrap around that. And so what we were interested in originally was how can you use ORCA to communicate to those constituencies around things like data sharing, interoperability, the creation of standards, and ultimately use that as the gateway for digital integration. So how can we get applications gathering data and receiving data and flowing that from the handset all the way through to the clinical system and back again. And one of the things we think is ORCA is a really good opportunity, provides a really good opportunity for a foundation of that kind of approach. So this really summarises what we think the ORCA platform delivers to any organisation, developer, community, healthcare professional. And for us, it's that foundation stone. It's a great place. It's a simple but effective way to start a digital engagement strategy with your patient and population. Likewise, to do that with your health and care professionals, and obviously to engage with app developers in both specifically in areas of your specific interest, whether that's a particular condition or cohort, or geographically. And finally, where are we at this point in time? Well, very close to launch. Orca's now in the sort of final stages of user testing, and so we're actively seeking people who are interested in being testers, both from a healthcare professional perspective, from a user perspective, and also from an app developer perspective. So the guys who are just around the corner here will be happy to receive any offers of interest in relation to that. It's not an onerous testing process, I promise you. And similarly, on the other side, we're also actively now developing the first white label or Orca microsites. There's a number around diabetes in development and a number that are more geographically specific. So if anybody is interested in sort of joining that kind of process, again, if you register your interest around the corner or come and speak to me, that will be great as well. And that's it, but questions later.